Hello again, and welcome back to Neutralizing COVID, the monoclonal antibody story, the podcast where we unpack the science, strategy, and real world impact of monoclonal antibodies in the fight against COVID 19. I'm your host, Dr. Shikha Agrawal. Over the past few episodes, we have journeyed through the development and deployment of specific monoclonal antibody therapies that were crucial early in the COVID 19 pandemic. In today's episode, that is Outpaced by Evolution, the story of early COVID monoclonal therapies. We are taking a broader view, looking at the overarching narrative of these first generation emergency use authorization or EUA monoclonals, their initial triumph, and the immense challenge posed by a rapidly evolving virus. We are again fortunate to be joined by Dr. Aiswarya Chaudhuri, a nanoformulations expertise who will help us unpack this science. Welcome back.
Hello, Dr. Shikha. It's good to be here to discuss this important arc in our pandemic response.
When these monoclonal antibodies first emerged, it felt like a significant breakthrough. Could you recap for us the initial promise they held and how they worked?
Absolutely. The speed at which these therapies were developed and authorized under EUA was unprecedented and genuinely a scientific triumph. We are talking about antibodies like bamlanivimab and etesevimab, casirivimab and mdvimab, that is Regencov, sotrovimab, and the preventative combination, that is tixagevimab and cliravimab, that is the Evusheld. Their core mechanism was to target the SARS-CoV-2 virus's spike protein. This protein is what the virus uses to enter the human cells. These antibodies were designed to bind to specific sites on the spike protein, effectively neutralizing the virus by blocking its entry. And they worked. Clinical trials and the real world use showed that when administered early, particularly to the higher risk individuals infected with the initial strains of the virus or early variants like alpha and delta, these antibodies significantly reduced the hospitalization and deaths. They were a critical new tool when we have very few options.
So they offered a new line of defense. But the spike protein, while a good target, also became their Achilles heel. Why is that?
Precisely, the spike protein is essential for the virus, but it's also on the virus's exterior, making it a prime target for the immune system and for the antibody therapies. However, RNA viruses like the SARS-CoV-2 inherently mutate frequently. Some of these mutations can occur in the spike protein. If these changes alter the sites where our therapeutic antibodies are designed to bind, the antibodies can lose their effectiveness. This is the core of the immune escape. The virus evolves to evade the immune pressure, whether from natural infection, vaccines, or therapeutic antibodies.
Very well explained. We started seeing this play out as new variants emerge. Can you walk us through that turning point, especially with the rise of variants like Omicron?
Sure, Dr. Shikha. The early signs of trouble came when variants like beta and gamma, which had mutations that reduced the susceptibility to some of the initial monoclonal antibodies. However, the Omicron variant, which was emerged in late 2021, was a game changer. Omicron has an exceptionally high number of mutations in its spike protein, over say 30 in the early stage, some early sublineages, many of which were concentrated in the receptor binding domain and the N terminal domain, the primary targets for most of these EUA antibodies. Now, these extensive mutations mean that the antibodies, which were designed based on the spike protein of earlier version of the viruses, often couldn't bind efficiently to the Omicron spike protein anymore. It was like trying to use an old key on a newly changed lock. So the result was a dramatic drop in neutralizing capacity or activity for many of these therapies against Omicron and its subsequent subvariants.
This loss of effectiveness must have created huge challenges. How did regulatory bodies and the medical community respond to this rapidly shifting landscape?
It was a very dynamic and challenging period. Regulatory agencies like the US FDA had to continuously monitor the in vitro data, the animal model data, and the clinical efficacy data also against the newly emerging variants. As it became clear that certain antibodies were no longer effective against the predominantly circulating strains, their EUAs had to be revised or in many cases withdrawn. For example, throughout 2022 and early 2023, we saw the FDA limit the use of several of these major monoclonal antibody treatments because they were simply not expected to work against the Omicron subvariants that have become dominant. This meant clinicians had to adapt quickly, and public health guidance needed constant updates, which was, of course, very complex to manage.
Looking back at this rise and fall, as it were, of the early EUA monoclonals, what are the crucial lessons learned?
There were many profound lessons. First, it highlighted the incredible speed of modern science to develop and deploy the countermeasures in a crisis. These antibodies undoubtedly saved lives when they were very effective. Second, it was a stark real world demonstration of the viral evolution in action and its a direct impact on the medical intervention. The virus can and will evolve to evade pressure. Third, it emphasized the importance of targeting highly conserved regions of the virus, areas that are less likely to mutate because they are critical for the viral survival. While the initial antibodies were effective, future efforts were even more focused on these stable targets. Fourth, it's underscored the need of a multi-pronged approach. We can't rely on a single type of therapy. Vaccines, various antiviral drugs with different mechanisms, and the next generation antibodies all play a role. And finally, even though the utility of these specific first generation antibodies waned against the new variants, the knowledge gained in their development from identifying the potent human antibodies to engineering them for the better properties and rapidly manufacturing them has been invaluable. It has laid critical groundwork for future antibody therapies against COVID-19 and other emerging infectious diseases.
So, while their period of peak effectiveness was limited by viral evolution, their contribution was still significant in terms of both patient impact and scientific advancement. Okay, so before we wrap up, a reminder to our listeners, our discussion today is for informational purposes only and is not a substitute for professional medical advice. Please always consult a healthcare provider for any health concerns. Dr. Aiswarya, you have helped demystify a really complex topic today, and I know our audience will appreciate it.
Appreciate being here. Thanks so much, Dr. Shikha. Understanding this history is vital as we continue to confront viral threats.
And with that, we wrap up another great conversation. Thanks to our audience for listening to Neutralizing COVID, the monoclonal antibody story. We hope this series has provided valuable insights into one of the most dynamic areas of research during the pandemic. Stay in the loop for future episodes, hit subscribe, and share this episode on your socials. Until next time, take care and keep exploring science.